Hello and welcome to Good Morning America Health. I'm Tanya Rivero. A new study published in the Journal of Pediatrics has red flagged a startling new trend of children being intentionally drugged for reasons stemming from the malicious to the mundane. But just how common is this growing form of child abuse? Joining us today for insight is Dr. Esteban Garcia, Director of Pediatric Emergency Medicine at the Maimonides Medical Center in Brooklyn, New York. Dr. Garcia, it's great to see you. Thank you so much for being here.
Thank you.
If you could first tell us a little bit about this study. I understand it was a study that took place over 8 years. What did it find?
So this study was a retrospective study that looked at malicious intent of giving pharmaceuticals or medications to children. It was from 2000 to 2008 and specifically found an average of 160 children being poisoned essentially with medications per year, and actually 2 deaths per year.
2 deaths per year. So over the course of this study, there were 16 deaths then? Or?
There were 18 deaths, over the course of the study. Additionally, the trend is that the number increased over the course of the 8 years as well. So it was, we were seeing more patients being drugged than before.
And doctor, were these deaths the result of continuous drugging or a single dose that was too much?
From looking at the study, it appears that a lot of these patients that died were probably a result of single dosing that was in excess of what should have been given to the patient.
And then did this, I understand that the author of the study is calling for this to be, declared a form of child abuse. Is that right? I mean, were these single doses, what was it determined that the parents' intentions were here?
I think that's the difficult part of the study, is that the intent behind giving the medications is unclear, and the study didn't look at it. But the Poison Center describes these cases as being intent to harm, so they're considered malicious. Parents may not understand what they're doing, but certainly causing harm by giving a medication can be viewed as child abuse.
And there certainly are, I mean, every parent here can tell you stories of someone saying, well, before we get on the plane, we like to give Junior just a drop of this, it helps him sleep. That is fairly common. How damaging is something like that?
Well, I think that's the issue with defining this as child abuse. Certainly that may even be a recommendation from some people and from grandmother or whoever saying, help Junior out with a little bit of this on the plane to help him sleep. The question here is that anytime you give a medication inappropriately, I think there are risks associated with that. And an antihistamine certainly has risks associated with it, though we don't always consider that.
So the study is making that very clear, that there are absolutely no circumstances in which a child should be given a medicine for which, other than for which it's intended. Is that right?
Correct. And it's easy if you think about child abuse as a form of a child being physically abused and you see bruises. We understand that, or a child being sexually exploited. We understand that as well. It's difficult here to understand why parents might do this. Some people believe that a child crying, maybe a little bit of something to help them sleep would help them. So a colicky baby, something like that.
Right.
But it is very risky.
And doctors never recommend this. This is something that parents are doing on their own.
Correct. I think that physicians understand, or parents understand, that the medication has some side effects that might help you to sleep if you take an antihistamine at night. It just doesn't translate the same to children.
And so let's talk about the importance of children then taking medication that is intended to be for children, because it's my understanding that in several of these deaths the children were given adult strength dosages. Is that right?
Well, it's very possible that they were either given an overdose of a child form of the medication or an adult form of the medication. These children, during their deaths that did die, also had the sedating agent. 17 of the 18 had something that caused them to sleep more, a sedating agent, potentially over the counter, but could have also been a narcotic that was prescribed for the parents.
Right.
So yes, certainly adult form of medications that weren't intended for the child.
And why is that so important? Why is it so important that a child only take children's medication at the correct dosage?
Because of the way the body is developing, children have medications that are based on weight. So we say so many milligrams per kilogram, as opposed to adults who tend to have medications, especially over the counter, that are unit based. You take one ibuprofen as opposed to a certain number of teaspoons for a child. So it's very important, because the body is different and the physiology is different, to only give children medication.
So going forward, do you think that this is something that doctors will be more aware of after this study?
I certainly think this is something we need to consider when we're evaluating a child for child abuse, or a child that has something we call altered mental status. They're just not acting right, or they're too sleepy to wake for feeds. I think those are things to think about as well.
Do you think there needs to be any kind of educational campaign? You know, we all know that there's been the Don't Shake Your Baby campaign, where so parents are educated on how damaging that can be to a newborn. Do you think that perhaps something similar needs to be done for this?
Absolutely. I think that parents, again, unintentionally may be giving a small amount of a medication to help a baby with colic, and I think that that's something that we need to be aware of, that these could be potentially dangerous and should be avoided.
All right, thank you so much, Dr. Garcia. And remember, for the latest in the world of health and medicine, you can always head to the health page at abcnews.com. We'll be right back.